Welcome back to our channel. Today, we'll be discussing an important topic to all women, which is contraceptives. We'll be covering the various types of contraceptives. We'll take a look at their advantages and disadvantages. We'll take a look at the recommendations as well as the ease of access. Here are some types of contraceptives available, offering individuals the freedom to choose what works best for them. Let's explore a few popular options. The first one is the barrier method. This method includes the male and female condoms. These physical barriers prevent sperm from reaching the egg and also reduces the risk of sexually transmitted infections. Condoms are thin, stretchy pouches made of latex and other materials. They are designed to cover the male sexual organ, which is the penis, or the female sexual organ, which is the vagina, in case of the female condom. Condoms prevent unwanted pregnancies and reduce the risk of sexually transmitted infections. Condoms come in various types, sizes, textures, and even flavors, making it easier to find one that suits your preferences. But what if you or your partner are allergic to latex? It's good to know that condoms are available in materials such as polyurethane or polyisoprene. Aside from preventing pregnancy and STIs, condoms offer a few extra benefits worth mentioning. These benefits are as follows: they are readily available, they are affordable, they are easy to carry around discreetly, and they don't require a prescription or a visit to the doctor. While condoms are highly effective when used correctly, if incorrectly used, they can break or slip off, causing semen to contact the vagina. It is important to contact the healthcare provider as soon as possible within 72 hours to request advice and intervention on pregnancy prevention and STI prevention should you find yourself in a similar situation where the condom has slipped off or has broken. The second type of barrier contraceptives are the diaphragms and the cervical caps. These are inserted into the vagina to cover the cervix, blocking sperm from entering the uterus. A cervical cap is a small, flexible cup made of silicone or latex. It is designed to fit snugly over the cervix, which is the opening to the uterus. It does not cover the vagina. Its purpose is to block the sperm that is deposited in the vagina from entering the uterus. It is important to note that the cervical cap should always be used in conjunction with the spermicide to increase its effectiveness. Spermicide is a substance that contains chemicals that immobilize or kill sperm. Like any form of contraception, the cervical cap has its advantages and disadvantages. The advantages being it is a hormone free option, it is reusable, and it uses less spermicide than a diaphragm. The disadvantages being it is not suitable for everyone, particularly those with certain medical conditions, such as a history of toxic shock syndrome. It is difficult to insert for other people. It also needs a doctor to measure the cervix for a proper fit. It is crucial to remember that the cervical cap does not protect against sexually transmitted infections. If you're concerned about STI prevention, it is rather best to use condoms. The second class of contraceptives are hormonal contraceptives. Hormonal contraceptives are medications or devices that contain synthetic hormones, such as estrogen and progesterone, They work to alter a woman's hormonal balance to prevent pregnancy. Hormonal contraceptives are available in oral form, such as the tablet, in injectable form, in device form, as well as patches. The contraceptive hormone vary in terms of the amount of hormones that is delivered by the contraceptives. Your healthcare provider will assist you to choose one that is best for your age, your needs, and your circumstances, as every individual is different. These contraceptives primarily work by inhibiting ovulation, which is the release of the egg from the ovaries. They also work by thickening the cervical mucus, making it difficult for the sperm to reach the egg. And finally, they work by thinning the lining of the uterus, reducing the likelihood of implantation. Let's briefly explore a few popular options. The first option is the combination pill. These are tablets or oral contraceptives that contain both estrogen and progesterone. They are taken daily, and it is important to follow the prescribed schedule religiously to maintain their effectiveness. Another type of pill is the progesterone only pill, also known as the mini pill. These oral contraceptives contain only progesterone. They are suitable for women who are breastfeeding, also women who are sensitive to estrogen. The third type of contraceptives that are hormonal is the patch. The contraceptive patch is a small adhesive patch that is applied to the skin. It releases hormones into the bloodstream, providing continuous contraceptive for 1 week at a time. It usually comes in 3 patches, each for 1 week. The fourth week is usually a patch free week. The fourth type of contraceptive that is hormonal is the vaginal ring. The vaginal ring is a flexible, transparent ring that is inserted into the vagina and it is left in place for 3 weeks. It slowly releases hormones and is replaced monthly. And then finally, we have the injectable contraceptives. These are hormonal injections that provide contraception for a period of several weeks or months, depending on the specific product. The popular ones widely available are the Depo-Provera and the Nisterid, which are the 3-month injection and the 2-month injection, respectively. It is important to know that the hormonal contraceptives are available by prescription only. It is crucial to consult a health professional provider who can guide you in choosing the most suitable option based on the individual needs and medical history. While hormonal contraceptives are highly effective at preventing pregnancy, it's important to understand that they do not protect against sexually transmitted infections. If you are concerned about STI prevention, using condoms in combination with hormonal contraceptives is recommended. Hormonal contraceptives offer additional benefits beyond pregnancy prevention. These benefits are as follows. They help regulate menstrual cycle. They can reduce menstrual cramps and pain. They improve the symptoms of conditions such as polycystic ovary syndrome or PCOS in short. They can also improve pain of endometriosis. Be aware of possible side effects and risks associated with hormonal contraceptives. These can vary depending on the individual and the specific method used. But common side effects include irregular bleeding, breast tenderness, nausea, and mood changes. It is important to discuss any concerns with your healthcare provider. Another form of contraceptives that are available are the long term hormonal or non hormonal methods that deserve a class of their own due to the length of period they offer protection. These are called the long acting reversible contraceptives. There are those that can be inserted under the skin, such as the implant, and those that can be inserted in the uterus that are called intrauterine devices, or in short, IUDs. IUDs are small devices that are inserted in the uterus. They can be hormonal or copper based. We also have implants. These are small rods that are placed under the skin and release hormones to prevent pregnancy for several years. The contraceptive implant is a small, flexible rod that is inserted under the skin of the upper arm. It releases hormones and provides long term contraceptives. The above method offers a great degree of protection against pregnancy, but not against STIs. They also require a healthcare practitioner for insertion and removal. The uterine devices also require monitoring by a healthcare provider at least once a year. The last form of contraception we are going to look at is the sterilization method or a tubal ligation method. This is a form of contraception that involves tying off the fallopian tubes by a healthcare provider under anesthesia. This method is reserved for women who no longer want to bear children and have reached the desired number of children, as this method is not reversible. Tubal ligation offers the highest level of protection against pregnancy. However, there are rare cases of pregnancy that happen due to recanalization, as there is no form of contraceptive that is 100%. This discussion will not be complete without us mentioning one important pill that can prevent pregnancy after a sexual encounter has happened. This important pill is called the emergency contraceptive pill. While it is not used as a regular contraceptive, it is one pill that is easily accessible that can prevent pregnancy after an episode of unprotected intercourse or burst condom. It is available at most healthcare provider, pharmacies, and must be accessed as soon as possible within 72 hours of intercourse. That was an overview of all the types of contraceptives that are available. Please like, subscribe, and share with your girlfriends. Also, check out our other videos where we dive deep in each contraceptive method. Thank you.